So in that sense, I think that there's, these are just like incredibly addictive drugs. But I think that there's certainly a point where we just would refer out for kids who have ongoing substance use issues. But it's a rare case where where it's someone who really needs pain medicine for the kids and you don't want to give it to them for some substance use reason.
So in acupuncture, we in Oriental medicine, i.e. herbs and such, we don't prescribe drugs at all. We have no prescription writing in our scope of practice. We do prescribe herbs. Interestingly enough, one of the most common treatments in drug and alcohol diversion programs in the judicial program, into the judicial system, is to acupuncture. And they're usually set up like Central City Concerns has a couple of different clinics where people who have been, gotten before a judge, and it's either go to jail or go to this program where they're going to do acupuncture on you, 2, 3, 4 times a week. Actually, at the Detox Center right up the street here, Hooper, they do acupuncture there. We have some of our students go there and as interns and do acupuncture. But to go back to this concept of drug addiction, one of the things that I find really interesting is that they're coming now to a broader understanding of addiction and how the addiction is related less about the substance and more about the individual's need for human connection and for a good living situation where they're feeling connected with people. I'll talk about it afterwards if you're really interested. I don't want to take up the rest of the time. Unless you all really want.
Listen, if anyone's got anything to say about drug, I'm not sure exactly what you meant by what do we do directly, or is there some special management that you have to do, a special way you have to attend to them, or care? Do you mean do we directly address and try to help them with the substance abuse? We can answer both, but.
More how you would manage.
More how you would manage.
Yeah. The physical is the physical. I'm a holistic practitioner. I recognize there's no separation, but still people have physical problems and they can be helped. I happen to have a lot of experience in this field because of the community. I just always have been in the addiction community for whatever reason. I've been attracted. I did volunteer work in a homeless shelter with a lot of addiction. And so, but they can fix just like anybody else physically. So it's whether they're going to go and try to trash themselves again, and whether they're going to recur and so forth. Yeah, I will say that we know that 50% of the pathway to addiction is because of pain. Supposedly 50% of the pathway was through prescription pain meds. So I took an addictionology sequence, a number of modules, and my mentor incorporated chiropractic and acupuncture in a facility in Florida, and he got 100% non-dropout rate. He had 100% persistence, which was like unheard of in the kids that were doing this population that was doing the treatment program. He worked in a resident facility, and that at that time was like never happened. But it was a combined approach, and that's you treat what you can treat. You go what you can go after, and correct what you can correct, and they can heal just like anybody else.
Thank you, Jeff.
So I think that's a very, we could all sit here and probably talk forever on it. I think, I'm going to throw this out here. It's interesting because I do pain management. I used to manage a lot of narcotics, and my initial, I don't want to be long-winded, so just cut me off.
No.
So, but at some point I got to where my clinic looked like a methadone clinic, and I'm a naturopath, and I was like, how did I get here? I walked out and I was just like, I was losing staff. My staff was stressed. And it really kind of hit home. It was just like, what the heck is going on? And my initial reason for prescribing any of these drugs was because I was trying to get them off. And I took on a huge animal that I think is infectious, like within the country that we're trying to handle. The problem that we have now is that there's a difference, there's a difference between addiction and dependency. So there's a difference. There's people who have true pain, but I think like throwing narcotics at it, you're just creating a problem. Because you have gliosis, you have all this like transformation in the brain and all this stuff that happens from opiates. But I think honestly, like if you're truly dealing with addiction, like the best thing I can say for my patients that I do is I hold them accountable. And I will say, like, if you truly feel addicted and you're using, I'm gonna make you do urine tests for me. And we're gonna, you know, if you truly wanna come off it, I'm gonna keep you accountable. I don't care about the court system or this or that. I still hold them as accountable as I would with somebody I'm prescribing to. And I put them on a plan, whether it be acupuncture and chiropractor. I mean, you need a multidisciplinary approach. And you need the psychologist, the behavioral therapy. Like, you really need a team that's taking care of it. One of the councils I'm a part of is I'm a part of McMinnville. I'm a part of developing a persistent pain program. And in that program, we treat about nutrition, we treat about yoga, and it's people who have Medicaid have access to it. It's paid for. And it is amazing. It's amazing results. The statistics as far as like what we're doing with these patients, I have patients that were on like 800 milligrams of morphine a day, which is huge, huge, that are like, we tapered off the morphine, and I think getting them off the morphine, the pain's better, but they have addiction, like, and we're having them just move and do all these other things that they really never had access to. And that ultimately, providing access and having access to care, which is a huge buzzword, is important. If we can kind of get these people to have access to truly like what all of us up here are doing, it's gonna really help a lot of people.
Great, thank you all so much for your time. That's all for today. Please feel free to stick around, or if you have any questions for these guys, let us know. So like I said, there are snacks in the back. Please help yourself. Check out the raffle table and see if there's anything that you guys are interested in winning later. And then the next panel will start up in about 25 minutes. Thank you.